So the pancreas has two roles. One is called an endocrine function, and that is to help us regulate our blood sugar levels by the pancreas producing hormones such as insulin. The second role of the pancreas is called the exocrine function, and that role helps us to break down, digest and absorb nutrients such as fats or proteins from our food. Symptoms can be quite severe, particularly if foods aren't being absorbed properly. The stools actually appear quite yellow, quite pale, and often are quite difficult to flush when people are using their bowels.
If someone has a pancreatic cancer and the pancreas isn't functioning properly, they can have issues with digesting their food, and that can present as predominantly a diarrhoea, which is basically food that hasn't been digested passing through. Patients can also experience a lot of pain across the area, and that can go into the stomach as well, and that can lead to nausea and poor appetite and not wanting to eat. So they can eat a very small amount but feel like they've eaten a really big meal.
One of the common questions that we do get is, will I develop diabetes and how will I manage this? And so it's important to note that not everybody will develop problems with regulating blood sugar levels after they've been diagnosed with pancreatic cancer, but some people might. And this is because the pancreas just might not be working as well to produce the hormones such as insulin that help to regulate our blood sugar levels.
Back towards the end of last year it was that I was losing weight, shedding quite a bit of weight. I think I was having to drink more, and my stools were yellow. My skin was yellow, and a nurse at the GP clinic picked up the fact that I was looking yellow. And it just turned out that I had a blocked bile duct. And subsequent investigation about that bile duct, they found a 13mm tumour on my pancreas. Before the operation, I think I was holding it together, but I was certainly shedding a great deal of weight. I think I dropped from 68 kilograms to low 50s.
The side effects of treatment really depend on the type of treatment and the dose of treatment that is provided, but in general, a lot of the symptoms from treatments are generally the same: poor appetite, nausea or vomiting, or just general feeling unwell and not really wanting to eat.
Some of the common things would be, for example, for nausea, would be eating small meals frequently through the day. For the taste changes, we may talk about trying different foods or staying away from particular foods.
Side effects of surgery really do relate to the fact that some of the pancreas, or sometimes all of the pancreas, has been taken out. People can experience things like the diarrhoea or bloating or pain when eating.
And if patients are experiencing diarrhoea and food malabsorption, so where the food is just passing through without it being digested and absorbed into the body, we may talk about using a pancreatic enzyme replacement therapy.
So seeing a dietitian is really important because we're able to tailor our nutritional recommendations according to each patient's situation.
So if, for example, if a patient is of an Asian background and they eat a traditionally Asian style diet, we will tailor our advice around that.
There's a lot of really good evidence that shows that maintaining good nutrition and maintaining weight and strength really do help people to get through their treatment a lot better. It increases the body's ability to get through the treatment, feel good during treatment, and even helps boost our immunity and even our general quality of life and how we're feeling on a day-to-day basis.
Things that patients can do to help through the treatment is, again, very patient specific, but certainly some light exercise, even a walk around the block in some fresh air. That can help with digestion, it can help with nausea, and it can help with a sense of well-being. Psychology counselling, for example, is something that a lot of patients go through. All these things together, I think, can really help a patient get through the treatment process.
Sometimes people do struggle to have the smaller, more regular meals. In this situation, we do really try and work with people to work out what suits them and how we can adapt our plan to make sure that they are getting their nutrition in the best way that suits them at home.
So oral nutrition supplements, they're very high in energy, and they're also nutritionally complete in that they have all of the vitamins, the minerals that patients need as well. And they can be used when people can't eat very well to make sure they're actually getting enough. Pancreatic enzyme replacement therapy, also known as PERT, or by the product name, which is more commonly what patients will hear it as Creon, is a very clever little product that doctors can prescribe, but dietitians will also help with, that replaces the job of the pancreas.
Ray definitely has the story of many patients that I've seen in my experiences working with pancreatic cancer.
Well, when I shed all this weight, it made me feel quite vulnerable. I wondered whether this was the end. In fact, I remember having to debate whether I'd go ahead with this pancreatic operation.
So if someone like Ray came to see me in my clinic, I would weigh him, I would ask him what he's been eating, what type of symptoms he's been having that have been impacting his ability to eat, and I would also calculate what type of requirements Ray has for calories and protein in order for Ray to get the best nutrition possible to get him through his treatment. It can be quite challenging for people to make some of the changes that we recommend to their diet, but we often really do work with people so that they understand how important it is to start to try and make these changes, because their nutrition is so closely linked with how they will go during their treatment.
I tried to carry on as normal, and to an extent I did, but that changed after the operation, after I lost the head of the pancreas. That really changed how I approached all food and drink. I couldn't have 3 big meals a day, as I was all my life I've had. I was advised by the dietitian that I must now have smaller meals and I must eat between meals. So that was a challenge to me. I must admit I didn't follow specifically that for a start, but I soon learned that was the way to go, because I had reactions in my stomach and I couldn't sleep properly. I could overcome the loss of weight, and I am putting on weight. It's helped me absorb food. It's helped me put on weight. It's helped me gain strength, particularly after that operation. And I feel that I'm in a positive upward trajectory of recovery.